It's been 4 years since 988 has been a resource for Ohioans. This week on The Big Picture, we talk to people who work in the mental health industry, including a call talker and a person who has used the helpline.
And we want to share their experiences with you and share the messages of that short 3-digit number that people can call whenever they feel like they need help, however they define a crisis.
And right now we are being joined by Amanda Schulte, and you are someone who turned to this service when one of your loved ones needed help. Thanks for coming in. Talk to us a little bit about the experience that you had with 988.
Sure. I was with a very close friend who was really struggling with his mental health. And in that particular moment, he was very upset and he shared with me that he wanted to die. And I kind of went into a panic. I didn't know what to do, and I knew that I was not equipped to help him at that moment, to keep him safe and do whatever we needed to do to, help him. Thank goodness a memory kind of popped up in my head of 988. And I told him I'm going to call 988 and I'm going to put them on speakerphone. And I did that because I knew that a trained professional was going to answer the phone and could help us kind of navigate that situation. And that is exactly what happened.
That must have been so tough. How did your fight or flight kick in?
It was really scary. Like I said, I panicked. And then when that person on the other line answered, she provided such calm, and she spoke in this very non-judgmental way that immediately put me at ease. And it really reassured me that I was doing the right thing, and I was kind of able to get down to business and explain exactly what was going on with my friend. And then she kind of assessed the situation. My friend happened to be had a mental health provider appointment the following day, coincidentally. And so she determined that he was not an immediate threat to himself, and decided that what we needed to do in that moment was put together a plan that was going to get him through the next few hours to get to that appointment the following day. And so she kind of walked us through what that would look like, what the plan needed to be for us to get through.
Wow. So she gave you the tools how to work through all of that.
She did. And
that's incredible.
The tool, the biggest tool that she provided in that conversation was how to create a safe space for him. And that was the plan we put together. She explained that what we needed to do over the next few hours was things that were comforting to him and that would take up time. And so she brainstormed with us, and we decided we were going to order a pizza. We got ice cream, and then we picked several movies that he found comforting and, enjoyed. And that was the plan that we were going to follow. And I think it gave my friend some control over the situation in that moment because he participated in creating that plan. And it gave me such a sense of reassurance that this trained professional had assessed the situation and put together this plan with us. And then at that point, all we had to do was follow the plan. And it took this incredibly scary, emotional, just crisis situation and kind of laid it out in easy to follow steps. Get the pizza, get the ice cream, put on the movie, stay together. And that was what we did.
Yeah. Were you afraid to hang up and end that call?
No.
Okay.
I just felt so confident in what she had done. She talked to us for a while. She had me step out of the room at one point and just talk to my friend. And then she brought us back together. And she explained her thought process. And again, she made things so simple and broke them down into such a way that even my panicking brain could follow what she was saying and trust what she was doing. And the other thing about getting off the phone with her, now that I had made that call and I knew what to expect on the other end, I knew I could just call again. So if things started to go wrong, in the next few hours, all I needed to do was pick up the phone again and call.
Right.
And I mean, I guess, there's the hindsight of this of like, okay, maybe I could have thought of, here are the ways that we could have worked through this. But in that moment, having that person on the other end of the line to say, how about we try this, is kind of that, it's the person removed from that situation to be able to see things kind of from above and talk you through that situation, because no one is ready for that conversation. It is a difficult conversation to have when your friend comes to you and is kind of like, I need help.
Exactly. Yes. And she was this objective person that kind of brought us down to this, place where we could think rationally with her, and really put us at ease and let us know that we were doing the right thing to keep my friend safe.
Absolutely. I mean, 988 is a lifeline, literally. So how is your friend doing? I would like to ask.
He is doing so much
Okay.
better. I was just telling someone in preparing for today, he was actually helping me go through various questions and kind of reflecting on the situation. And he had said that he forgot how horrible things were at that point in time. But I think that just goes to show we were able to get him help. And he has come such a far way. And we would not have been able to do that without that first phone call that we made to 988.
And I think a lot of people, when they hear 988, they think about it's only for if that you yourself are going through a mental health crisis or any sort of crisis, drug addiction. I mean, you can call that number for a variety of reasons, but I love your perspective on how you happened to be with your friend and, you were there.
That is so important, and it's such a common misconception. I had it when I first heard about 988, that you have to be the person going through the crisis to make the phone call. You do not. I was not going through the crisis. I just knew that my friend needed help, and I was not equipped to provide him with what he needed in that moment. So anybody can make the call, and it's free.
We are joined by Sue Valillo with Adam H here in Franklin County to talk about some of those services that are available if you are someone who needs to make that call for yourself or someone else. And when 988 started 4 years ago, from Adam H's perspective, what was some of the need that was out there?
Well, when this was proposed 4 years ago, we were very excited at the Adam H board. This really provides a behavioral health solution to a behavioral health crisis. What we were seeing were so many people calling 911 when what they really needed was mental health assistance rather than a first responder. So to be able to have that available all the time, any place you go in the country, was really important to us, as well as the fact that it is such an easy number to remember. We had 2 great crisis hotlines operating in Franklin County, but you had to remember the entire phone number.
Mm-hmm.
And with this, it's just 988. And speaking of your guest, Amanda, yesterday, she said, I remembered this 988. Yes, it's so easy to remember. It makes it really accessible for people to call when they need help.
Yeah, and she was wonderful to speak to. I mean, because she just offered the perspective that when you hear 988 and when to call, you don't have to personally be going through the crisis yourself. You can be helping a friend or a loved one. I think that was an important message to get out.
It's very important.
Yeah.
Thank you. Yes.
Absolutely. So how has the need changed in the last, 4 years since this number has launched?
I think what we've seen over the last 4 years is just an increased number of calls coming in for behavioral health crisis, to 911, to 988, to some of those legacy lines, crisis lines we had in Franklin County. We just see the volume continue to grow, and more calls are being diverted to 988, which is fantastic. That's sort of the first step into getting help. But we are seeing just an increase in volume across all call lines.
And when somebody dials 988, when that call is initially picked up, are there options that kind of give you where to route it to for a specific option? Or is whoever answers, the operator on the other end of that line, really trained to handle just kind of the breadth of anything that somebody could come in with?
I'm going to say yes to both of those questions.
Okay.
So you can opt in for a Spanish-speaking line, or you can opt in for a veterans-specific line. The person who answers the call, however, is prepared to respond to any crisis anyone is having just across the spectrum. The nice thing about 9882 is that the response is standardized across the country. So you know what to expect when you make that call. If you've made it once, you're going to get the same kind of response the next time you make it.
And when people dial 988, it's not just for suicide. We were touching on this. What are some of the other crises that people are experiencing that they can call 988 for and receive help immediately?
It's really up to the individual to define a crisis. So anytime a person is experiencing emotional distress that's sort of interfering with their functioning, maybe they're not thinking clearly, they don't know what's the next step should be for them. It could be, as Amanda, a friend or family member concerned about a loved one. So it's really whatever the individual is defining for themselves as a crisis, that operator is trained to respond to.
And I'm just curious because when we were speaking with Amanda, she talked to us about the whole situation and how the operator helped calm her down. And then they worked out a plan together, a step-by-step plan for the rest of the day to calm her friend down and make them feel better. Does that all just depend on what that person's going through who's on the other end of the line? And at what point do operators maybe call for more help or first responders to come to a location?
It's very, very infrequent that 988 results in a transfer to 911 or to get some kind of first responder help. That does not happen often. What typically happens is exactly what Amanda experienced, is that there's a plan made on that call. And that plan may be for tomorrow when you've got an appointment, or it may be for getting you set up with an appointment that you need, or it may result in having someone come out to you to actually help you where you are in your home, in the community, if you're not getting things resolved on the phone call.
Right, and it's those next steps that are vitally important to know the resources that are available out there, and those are some of the things that are provided by Adam H. Obviously, we have that beautiful new facility on Harmon Avenue that it recently opened, but there's so much more to Adam H. when it comes to that wide variety of people experiencing different sort of crises.
Yes, we really think of crisis as a continuum. So someone to call, that's 988. If your crisis can't be resolved on the call, then there's someone to come. And that's a mobile crisis team with clinicians that can come to you in the community to help you. If that's not resolving your crisis, then you can go to the Franklin County Crisis Care Center for additional help and services. And even as you leave the Crisis Care Center, you can be connected to ongoing care to prevent another crisis episode from occurring.
And we talked about the new crisis care building a little bit. How operational is that right now? What are the services that people can walk in and get if they are experiencing a crisis and decide to go there instead of calling 988?
Sure. The building opened in September of 2025, so we are ramping up the levels of care that will be available in the building. Right now, there is a 23-hour crisis observation unit. So for people who are in crisis, they can go there. The idea is really to help them become stable and then plan for those next steps. So someone can stay there up to 23 hours. So we have capacity in that part of the building right now with some future growth planned for behavioral health urgent care, which is kind of a lower level of need. You walk in, you can maybe see somebody immediately, get very quick assistance, and move on with your day. And then eventually it will have an inpatient part of the facility for folks needing longer term care.
Mm-hmm.
And for, and back to dialing, when somebody, might be waffling with the idea of, do I make this call? Do I not? Obviously, there's always privacy concerns over there of like, oh my gosh, I don't want somebody on the other end of this line to know who I am. How do you, for the folks out there who might need to turn to this line, address those concerns that it's okay to make this call, that information is between you and them?
That is a very valid concern, and I'm glad you asked that question. So 988 is completely confidential. You don't have to give your name. I can call and say, hi, I'm Sue, and not give any more information about me if I'm not comfortable with that. Of course, you can give more information if you'd like. And unlike 911 that knows where you're calling from, 988 doesn't. Your call gets routed by a cell phone tower, so at best, we would know what cell phone tower you're closest to. We wouldn't know an address. So it is confidential, and you can share the amount of information you are comfortable sharing.
This sounds like it's hard to be on the other end as the operator. What kind of training do they go through?
They go through extensive training, and in fact, our Franklin County North Central Mental Health has been recognized for the training that they do. There's training that is required through SAMHSA for the operators, as well as training by our local operators, North Central Mental Health and NetCare, in addition to that training. So it's quite extensive. And both of those organizations have been operating crisis lines for many, many years and are very skilled at the work they do.
And it's all right if you don't have this off the top of your head, but do you know a relative call volume that frequent, is there a call volume that comes into 988 on a regular basis?
Right now in Franklin County, we receive about 150 calls a day on 988, and this is growing literally month over month as more people become aware of the resource.
And the crisis care center that's opened, how is that alleviating emergency room visits in the county so far?
Well, it does two things. It gives people a place where they have a choice that they can go to the crisis care center as opposed to an emergency room where there's often a longer wait time. And for first responders, our crisis care center, operated by RI International, guarantees a 5-minute exchange. So when a first responder is bringing someone in, the RI guarantees that that first responder will be back on the street in 5 minutes. Very difficult for a hospital to do, so it's made it really accessible for our first responders.
All right, and if you didn't get the number, it's 988.
Right. Free, confidential, available
Yes.
24/7.
Thank you so much for coming on. Is there anything else you want to share about just 4 years of 988?
No, I would just like to thank you for this opportunity to talk about it and to make people aware of this resource that's available to everyone.
Wonderful.
Sue
Thank
Valillo,
you.
thanks so much for joining us. From Adam H.
Joining us right now, we have Kendra Tolber. And when we talk about 988, a lot of people think it's a phone number you can call, but you can also text it. So talk to us about what exactly you do on the other end of the phone.
Yeah, certainly. So, you can text in or on your phones or on your tablets, computers. And once you do that, you will connect to a clinician, such as myself or other peers. And then from there, we just talk about what's going on. We want to figure out what brought you to this line. And from there, we will, ask questions. Sometimes it can be hard for people to open up about some of the difficult things that they're going through. So we kind of help guide that conversation, ask some questions, and then from there, once we start to build a little more rapport, people are more apt to opening up and talking about what's going on.
Now, it seems more challenging to be on the texting end of things rather than a phone call when someone's in a crisis. So what are some of the challenges that come up with that?
Certainly. So, obviously, we have to ask a lot of clarifying questions because, as we know, texting is different than talking. And so we will, ask clarifying questions to understand what is going on. And that leaves room for the chat visitor, is what we call them, to correct us if we're wrong. And so from there, we just kind of go back and forth like a normal text message.
And how long do these chats normally last?
Certainly. Anywhere from maybe an hour to an hour and a half. But it kind of depends on the need of our chat visitors. So sometimes it could be shorter, sometimes it can be longer, but we're there for whatever it is that they need in that moment. So,
What made you want to do this?
I feel this is incredibly important work, and I believe that no one should ever have to struggle in silence or alone. And so I wanted to be a part of a service that, when someone connects to the line, they are connecting with someone that is wanting to listen and support them, and just be there in some of their darkest moments. So, ideally, we want to make sure that, they're heard, supported, and, how do we help find a path forward?
And what are some of the most common questions that people have for you?
Yeah, so there's a lot of questions, and they can vary from, what resources might be in the community. Sometimes it's others reaching out for their loved ones, so they want to know how to support them. And so for those type of questions, I often guide them to our 988lifeline.org website. On that website, they have a beautifully, easy accessible website where they can learn just different tips on how to support their loved ones. And it's not as difficult as one might think. It's simply just being there in the moment with someone, validating, acknowledging, and, trying to stay calm, with them.
For a lot of people, reaching out to 988, it could be challenging, overcoming a hurdle personally for them. So is texting a really great option for them if they just feel a little shy about being on the phone?
Absolutely. Our chat and text feature is probably our most busiest line, because it gives people the ability to speak freely and not have that anxiety of phone conversations. We've learned that, a lot of people prefer texting over phone calls. So I definitely think that the chat text feature it continues to grow and expand.
Okay.
And we heard earlier this week from someone who's used this service, but said she called and she talked about how the operator on the other end of the line, the clinician, was, worked through that process of how do we make a plan when it comes to making that text message instead of making that call. How does the service differ at all? And also, what are some of the challenges that are presented by you who is doing this over a text communication instead of, voice?
Sure. So the way in which we would navigate those situations, whether call or text, are the same, and ultimately when we're upon connection, we're immediately trying to listen and understand what's going on. And so it can be challenging at times through chat and text because it does take a little longer to, just in general, it takes a little longer to get through all of those things, but there's really no difference between how we operate on both of those lines.
I feel like the texting version of that, like it can be more preventative work as well, not just someone in an immediate crisis.
Absolutely. Yeah. So not everyone that contacts our line is like imminent risk. Sometimes people just need an outlet to vent and just a space where maybe they're not ready yet to talk to their friends or their loved ones. So it does make it a little more maybe informal in a sense to be able to text just, hey, I'm having a bad day and I just want to process and talk.
How do you take care of your mental health doing this? Because I'm sure a lot weighs on you.
Yeah, I am very big on self-care, walking, journaling, all of those fun things to just decompress. But, I do find a lot of honor in being able to be there in some of people's most darkest and difficult moments of their lives, and hopefully help them find a path forward. So,
Awesome. Thank you, Kendra.
yes, absolutely. It's a pleasure.